We're focusing on the simple habits that quietly protect your health over time, not the dramatic stuff. The basics most adults ignore until something goes wrong. These screenings aren't about fear. They're about awareness. Knowing what's happening inside your body before symptoms show up. Early checks offer clarity, confidence, and control. And for many people, they make the difference between managing a problem early or facing it too late. Health screenings are a quiet conversation you have with your body, a way to listen for whispers before they become shouts. Their power lies in early detection, because many of the most serious health conditions, from heart disease to certain cancers, don't announce their arrival with obvious symptoms. They develop silently, under the surface, for years. Screenings pull back the curtain, giving you a clear picture of your internal health. This isn't about creating anxiety, it's about providing peace of mind. When you know your numbers and understand your risks, you are no longer a passenger. You are in the driver's seat of your own well-being. This knowledge empowers you to make small, meaningful changes that can profoundly alter your health journey for the better, turning potential crises into manageable conditions. It's the ultimate form of proactive self-care. Let's start with one of the most fundamental checks, your blood pressure. High blood pressure is often called the silent killer for a good reason. It typically has no warning signs. You can feel perfectly fine while, internally, your arteries and heart are under constant, damaging strain. This relentless pressure weakens your blood vessels, setting the stage for devastating events like heart attacks and strokes. A regular blood pressure check is a simple, painless, and quick procedure that provides critical information. Knowing your numbers allows you and your doctor to intervene early, often with simple lifestyle adjustments like diet and exercise. It's a small action that directly helps prevent two of the leading causes of death worldwide, safeguarding your heart's future. Next, we need to talk about your blood sugar and the risk of diabetes. Much like high blood pressure, type 2 diabetes can develop silently over many years. You might not notice the subtle signs of prediabetes, a condition where your blood sugar levels are elevated, but not yet high enough for a full diabetes diagnosis. Ignoring it can lead to irreversible nerve damage, kidney disease, vision loss, and an increased risk of heart problems. A simple blood sugar screening, like a fasting glucose test or an A1C test, reveals what's happening with your body's ability to process sugar. Catching elevated levels early gives you a crucial window of opportunity to make changes. Through diet, exercise, and sometimes medication, you can often delay or even prevent the onset of full-blown diabetes, avoiding a lifetime of complications. Similarly, high cholesterol doesn't feel like anything. There are no aches, pains, or visible signs to tell you that fatty deposits, or plaque, are gradually building up in your arteries. This process, known as atherosclerosis, narrows the pathways for blood flow and can eventually lead to a complete blockage, causing a heart attack or stroke. The only way to know if your cholesterol levels are in a healthy range is through a blood test called a lipid panel. This test measures your total cholesterol, LDL the bad kind, HDL the good kind, and triglycerides. When you know these numbers, you can take targeted steps from eating more fiber-rich foods to getting regular physical activity to lower your risk and keep your arteries clear. It's a foundational step in long-term heart disease prevention. As we age, certain cancer-related screenings become an essential part of our health routine. The specific tests you need depend on your age, gender, and personal and family history. But the principle is the same. Many cancers are highly treatable and often curable when they are detected in their earliest stages. For women, this includes pap tests to screen for cervical cancer and mammograms for breast cancer. For men, discussions about prostate cancer screening with a doctor are important. For both men and women, colonoscopies are the gold standard for detecting and preventing colorectal cancer, as they can find and remove precancerous polyps before they turn malignant. These screenings are not something to dread. They're powerful tools of prevention that can literally save your life by catching a problem when it is small and manageable. Our vision and eye health are also critical indicators of overall well-being. A comprehensive eye exam does more than just check if you need glasses. It allows an optometrist to look directly at your blood vessels, nerves, and other tissues inside your eye. This unique window can reveal the first signs of other systemic health issues, such as diabetes, high blood pressure, high cholesterol, and even certain autoimmune diseases, sometimes before any other symptoms appear. Of course, these exams are also vital for detecting eye-specific conditions like glaucoma, cataracts, and macular degeneration early on. Protecting your long-term vision requires regular checkups, ensuring you catch problems before they permanently affect your sight and your quality of life. Hearing loss is another condition that often happens so gradually you might not even notice it at first. You might find yourself turning up the volume on the TV, asking people to repeat themselves more often, or feeling drained after social gatherings. This slow decline can lead to social isolation, frustration, and has even been linked to a higher risk of cognitive decline and dementia. An early hearing check can identify the extent of any loss and provide solutions, like hearing aids, that can dramatically improve your ability to communicate and engage with the world around you. It's not just about hearing sounds, it's about staying connected to the people and activities you love, preserving your mental sharpness and overall quality of life. Finally, we must recognize that mental health is an integral part of your overall health. It's not a separate category. Your mind and body are intrinsically linked. Routine mental health check-ins, whether with a therapist or as part of your regular doctor's visit, are essential. These conversations create a space to screen for conditions like chronic stress, anxiety, and depression, which can be just as debilitating as any physical ailment. Identifying these issues early allows for timely intervention, whether through therapy, lifestyle changes, or other support systems. Prioritizing your mental wellness helps you build resilience, manage life's challenges, and maintain the emotional balance necessary for a truly healthy life. It's important to understand that not all of these screenings need to be done every single year. The appropriate frequency for each test is highly individual and depends on a combination of factors, including your age, sex, lifestyle choices, and specific risk factors like family history. For instance, a young, healthy adult may only need a blood pressure check every couple of years, while someone with a family history of heart disease might need more frequent cholesterol screenings. The best approach is to have an open conversation with your primary care provider. Together, you can create a personalized screening schedule that is tailored to your unique health profile, ensuring you get the right tests at the right time. Screenings are about prevention, not about waiting for bad news. They are a tool for gathering information, for understanding the unique landscape of your own body. This knowledge doesn't corner you, it liberates you. It puts you in a position of power, where you can make informed, proactive decisions about your health. It shifts the focus from reacting to a crisis to actively building a foundation of wellness. Knowing your body and working with your doctor to monitor these key indicators puts you firmly in control of your health journey for the long run.